I'm Dr. Anthony Llewellyn, one of the psychiatrists here at the School of Medicine. Welcome to this clinical rotation in psychiatry for Year 4. On behalf of the rest of the faculty, the clinical deans, the supervisors, the registrars, the residents, the multidisciplinary team, all those people that will be teaching you in this clinical rotation, we'd like to warmly welcome you to psychiatry. We think you will have a very interesting, informative and fun experience and realise how important it is to consider the mental health and well-being of our patients, not just within mental health services and units and community mental health teams, but more broadly. So this video is intended to provide you some key messages to help you get started in relation to your rotation. Now, of course, in doing that, I need to remind you that it is always important to stay in contact with the official communication channels for the course, which of course are via Blackboard, as well as your official university email for important messages, updates and changes. You should also be checking in with the clinical dean for your site to ensure that you're aware of any specific learning requirements or opportunities. Just on that point, you'll find that depending on where you are doing your psychiatry rotation, your experience may be a little different to students at other schools. This is perfectly okay and to be suspected. At the JMP, we believe that it's important that each clinical school play upon its advantages. So depending on which clinical site that you're at, you should check in with your clinical dean as to any specific information about your rotation. For Hunter students, that's students based in Newcastle and Maitland clinical schools, there will also be a supplementary video touching on a few specific details about the Hunter Clinical School experience in 2020. So you should watch that video as well, if that applies to you. So what we're going to talk about in this video is the purpose of the mental health experience, the general structure of the rotation, your learning opportunities, resources to support you in your learning, and what we expect of you within the rotation, as well as the assessment that occurs at the end of the year. Towards the end of this video, I will cover what happens if you don't meet the requirements of the actual term. Now, if you go and look at the course outline, you'll see that there are a number of learning objectives in relation to the mental health term. But if we were to condense these main objectives of the psychiatry rotation, it would come down to two main things. One is to prepare you to have the sort of knowledge and capabilities and understanding around mental health in order to deal with the most common psychiatric conditions that can occur in medicine. So that, for example, if you were an intern in an emergency department in 2 years' time, which we sincerely hope you will be, or perhaps on a mental health rotation, you would be reasonably familiar with the common conditions and be able to do things like provide acute management, be knowledgeable about side effects, and speak with some authority about the types of things that can help when someone has a mental health problem. Secondly, we do believe that psychiatry gives you a really good taste of what it's like to work in an interprofessional team. We basically invented multi-professional teams in psychiatry and mental health, and we've been doing it for years. So you get a good chance not just to meet with other doctors, but value the experience of the nursing staff, as well as the managers, and of course the allied health professionals, in particular psychologists, social workers and occupational therapists. So take advantage of that. It's an opportunity to understand other people's roles and what they can contribute, not just in mental health, but in medicine more broadly. So the structure of the term is of course 6 weeks. That's 6 weeks. You will have a logbook that gives you some instructions about the sort of things that you are required to do during the term. This includes the workplace-based assessment tools. You should also note that there is a requirement to undertake a minimum of 35 hours of study per week, but this requirement will include things like your scheduled teaching time, as well as meetings like ward rounds and tribunals where relevant, plus your half day off for research group activity. Again, I would emphasise that the opportunities and requirements for study and attendance will vary between sites, so you should seek clarification from your clinical dean or local site coordinator. You should be aware that depending on which site you are at, there will be regular tutorial and teaching sessions, regular case-based learning sessions, self-directed study, and regular expert seminars scheduled for you, some of which may be conducted via online using something like Zoom. We do encourage you to try and attend ward rounds and mental health tribunals when you can. This activity in particular gives you a better understanding of the interface between medicine and the law, something that you don't get in most other rotations in medicine. There will also be a requirement for you to attend a certain amount of times outside of the normal working hours. This again will differ from site to site, but I want to emphasise the importance of this experience in particular. Firstly, medicine often happens a little bit differently outside the normal hours of a hospital with different resourcing levels. Secondly, for many of you who may be doing rotations that don't involve acute psychiatry, it gives you a chance to top up your experience of other types of patients and particularly see patients when they are more acutely unwell. In your logbooks, we ask you to do a number of mini clinical examinations, mini CXs and case-based discussions, CBDs. I'm going to break those down for you a little bit because you may not be completely familiar with these concepts so far and how we apply them in psychiatry. But before I do this, I want to emphasise to you that in these exercises, we are wanting to examine you as a member of the team that you are on. I also wanted to clarify who in psychiatry can act as an assessor. An assessor can be a consultant in psychiatry, a general practitioner, a career medical officer, a registrar, or anyone else who might be a member of faculty. If you are in any doubt about who can provide an assessment for you, please check with the psychiatry coordinator or your clinical dean. So we want you to be taking us to or discussing with us patients that you already know. I can't emphasise this too much because I often see students choosing patients that they're not familiar with. And that's not the point. We're trying here to mimic the experience you will have as an intern, where you do actually get to know your patients. So, a mini CX is a mini clinical examination. For this assessment, we want you to spend about 15 to 20 minutes talking to a patient in front of an assessor. Some important practical tips here. 1, you need to find the patient. 2, you need to make sure they are available. 3, you should also ensure a room is available. And 4, you need to set aside about 30 minutes for this exercise. For the mini CX, it makes a lot of sense if you agree up front with your assessor the type of feedback that you're wanting to receive around that assessment. So what I generally recommend is that you spend a few minutes giving the assessor a brief overview of the patient, unless they also know them themselves, and telling them what sort of feedback you are looking for. So for your first mini CX, you might ask your assessor to focus on your ability to elicit a mental state examination or examine the risk issues in a particular patient. Once you do more than one mini CX, you might move on to, say, a deeper understanding of the past history of mental illness, or perhaps something around counselling like a discharge planning exercise. You should be spending about 5 to 10 minutes at the end of that session debriefing. Thank the patient first for their time and then get your feedback from your assessor using the structured format in the logbooks. For the case-based discussions, the main requirement here is that 1, you've worked up a patient already, and 2, you and your assessor have 30 minutes somewhere quiet to undertake this exercise. The patient is not required for the CBD exercise. The CBDs are really great for practicing how you might hand over a patient as an intern and or present a current problem list to someone more senior. One thing I want to point out about the CBDs, however, is that you'll find assessors will vary in terms of the format they might be expecting from you and what they might focus upon in their questions. Again, if you think about this, it's great to be presenting cases to different colleagues, as you will come across this same issue as you head further into your career. So it's partly up to you to consider the feedback you get and how to incorporate this into your own preferred style of presenting. In general, we'll be looking for you to be able to bring along the information from a case and present it in a synthesised manner, as if you're handing over, say, on a ward round or discussing with a registrar. So it doesn't need to be a grand round style formal presentation extending for many, many minutes. It should be around 10 minutes. And then there'll be some time for some questions and some time for feedback in that 30 minutes. In general, you should be at least covering the following things in your presentation. 1, the patient demographics. 2, the presenting complaint and the history of that presenting complaint. 3, past psychiatric issues. 4, medical history. 5, the mental state examination. 6, a differential diagnosis. And 7, some kind of formulation and or management plan and or problem list. Again, this exercise is going to be useful to you because we're hoping that through this exercise you develop the ability to gather the right information that you need for patients and then be able to present this information to more senior colleagues in order to sort out what problems need to be sorted out for the people under your care. So a good approach to the case-based discussion is to think about what problems you would be wanting to think about for the patient if you were their intern. What things do you need input from the registrar or the consultant in relation to this particular case. So to recap, the mini CX and the case-based discussion are real-world examples of your performance. So you're free to actually go and talk to the patients beforehand, read through their files, talk to the team. Don't just set it up as if you haven't seen the person before. We want you to feel like you're doing this as a real intern who will generally get the chance to catch up with the patient first before having to present them to a colleague. We would hope that you get as many chances to obtain feedback using the WBAs during your term. You will be required to attempt the mini CX twice and the CBD twice. This is the minimum number of attempts required, so four in total. You'll also need to be satisfactory in both one mini CX and one CBD. If you have not achieved satisfactory performance in either the mini CX or the CBD, you may have up to 2 more attempts at either tool to achieve satisfactory performance. So 2 more attempts at the mini CX and 2 more attempts at the CBD. Allowing for additional attempts, we expect that most students will have achieved satisfactory performance by the end of the term. However, I would emphasise that it's up to you to organise your WBAs with an assessor. If you're experiencing difficulties getting assessments done, then let someone know about this problem early. A few other things about the logbook and the rotation that I want to let you know about. Firstly, we strongly encourage you to do an observation of an ECT session. Secondly, we want you to attend ward rounds and tribunal and inquiry hearings where possible. Thirdly, the Supervisor Report, which is also known as the Assessment of Professional Skills and Behaviour form, is the other key requirement for completing the term. The form provides feedback on your performance, but also sets the standard for what we expect of you as a final year student, which funnily enough is close to what we expect of interns in terms of their standard of professionalism. So you need to complete your logbook satisfactorily, which includes a satisfactory performance in each WBA as well as a satisfactory supervisor report in order to complete the rotation. And this will then permit you to go on to sit the end of year examinations, so long as you complete the requirements for the other clinical rotations as well. In regards to leave, you should always let your team know if you're going to be absent for whatever reason. Any time off requests are to go to the year manager first and then get reviewed for approval by the psychiatry coordinator. In most cases, if you're requesting time off, you'll need to make that time up at some other point during the year. If you've not been able to satisfactorily complete your term for whatever reason, you will be offered a period of remediation. Remediation will occur during those weeks in the year which are not scheduled for course activities. Remediation will usually occur at the Mater Mental Health Centre in Newcastle so that you can be provided with more intense support from the faculty who are based there. And it'll be for a week's duration. You'll first need to meet with the psychiatry coordinator to identify what it might have been the issues leading up to unsatisfactory performance, and then you'll be assigned to a unit and asked to complete another set of WBAs so you can get more feedback and demonstrate the required standard. In terms of the end of year assessment, psychiatry will be assessed in equal parts along with medicine, obstetrics and gynecology and paediatrics at the end of year exams, which consists of 2 papers of MCQs and an OSCE examination. So you can expect that there will be 50 questions about psychiatry across the MCQ papers, as well as in the OSCE examinations where you can expect that psychiatry will be the focus in some of these stations and integrated with other areas of focus in other stations. We're currently working on a progress test for the MCQs so you can familiarise yourself with the types of questions you might get asked, as well as some video examples for OSCE stations. Now there are resources listed to help you on the Blackboard website, and we also have the MedEd Help website, which may be where you're actually watching this video from. And this provides additional resources. Across both MedEd Help and Blackboard, we've given you a week-by-week breakdown of the topics we think you should be thinking about learning around and experiencing. On the first post on the MedEd Help site, you'll see a post called How to Study Psychiatry, Some Recommendations. We've taken the time to curate a lot of great resources, including recommendations around things like free and paid books, videos where you can practice things like the mental state exam, blog sites, podcasts, a whole bunch of things that can be helpful. And if you ever have something that you think should be added to that, we'd love to hear about it, by the way. So check out that website, because I think it gives a good structured way of approaching rotation, and we've had lots of great feedback from the students in past years about how this website is helpful and how it's helpful to have that sort of support and structure in place. Also on that site are some practice OSCEs, as well as helpful handy links to things like the College of Psychiatrists e-learning module on working with Aboriginal people with mental health concerns. And there is also a growing library of free e-learning resources there. We would like all of you to complete that e-learning module by the College of Psychiatry, by the way. It's a very informative, fresh module that I think will very much help you in understanding some of the issues around supporting people of an Aboriginal background with mental health problems. But also, actually, if you go through that module, you'll actually learn a lot about what it is in terms of best practice in terms of psychiatry in working with people in general. Now, your team are also there to help you. There's of course the university staff and in some sites education registrars as well to help. In terms of texts, we recommend the following as a starting guide. HETI's Acute Psychiatry Management Guide. It's a free text that's downloadable from the HETI website. It's now in its 3rd edition. This is a text that was initially put together for first year trainees in psychiatry in New South Wales. And actually, if you go through the contents, you'll see that it covers pretty much all the topics that we would expect you to know about in psychiatry, at least at a foundational level. I recommend it also to interns and residents who are doing their first term in psychiatry. Now, you may and probably will need to do some extra reading after reading this HETI guide, but the guide gives you a good snapshot and it's quite an easily digestible guide. And also because it's written from a New South Wales perspective, it covers New South Wales specific issues like the New South Wales Mental Health Act. And just as a reminder, there will be regular tutorials and teaching sessions, self-directed learning, case-based learning sessions, and expert seminars, depending on which site that you are at. So there you go, some key messages for your psychiatry rotation. We hope you found this to be helpful. Please contact one of the faculty or the professional staff if you have any questions or suggestions. And we do sincerely hope that you enjoy your rotation.
Yeah.